Did you know that heart attacks are the leading cause of death in many countries? According to the American Heart Association, around 6 million people suffer heart attacks every year, with over 300,000 deaths and 1.4 million hospitalizations, creating a huge burden on healthcare systems in the United States alone. After a heart attack, the consequences can be devastating for quality of life. We're well aware of the common risk factors: diabetes, high cholesterol, obesity, smoking, and high blood pressure. Today, we wish that your health is in the best possible condition. As the old proverb says, love one another and help one another. By subscribing to our channel and sharing our videos, you help us continue bringing more content that will help keep your health balanced. But what many people don't know is that certain medications, often linked to chronic conditions, can also increase the risk of heart attack. Yes, some drugs should be avoided if you already have cardiovascular risk factors. The relationship between medications and heart health requires close attention. So in this video, we'll discuss specific drugs that raise the risk of heart attacks. And we'll say this up front: it's crucial to use any medication responsibly, respecting dosages and medical guidelines. Before starting the list, it's important to remember, heart risks can rise not only because of the drug itself, but also due to dosage errors or prolonged use without medical supervision. It's essential to inform your doctor about all the medications you are taking to avoid dangerous interactions. Stay alert to side effects and take medications at the right times. Now, let's find out which drugs demand extra caution to protect your heart. Medication number 1, NSAIDs. Non-steroidal anti-inflammatory drugs, known as NSAIDs, are used to treat pain and inflammation and are popular across all age groups. However, studies show they can increase the risk of heart attack and other cardiovascular complications, especially in those with existing heart conditions. Since they're sold over the counter, excessive use is dangerous. Examples include ibuprofen, naproxen, diclofenac, ketoprofen, ketorolac, and indomethacin. The recommendation is clear: use NSAIDs at the lowest effective dose and for the shortest duration necessary. If you have a history of heart problems, talk to your doctor before self-medicating. Incorrect short-term doses, they are safe, but overuse brings serious risks. For fever or mild pain, prefer acetaminophen until you can consult a doctor. Remember, although aspirin is an NSAID, it has an added benefit. It helps prevent blood clots, thus protecting against heart attacks, unlike the others. Medication number 2, ketoconazole. Used for decades against fungal infections, ketoconazole is available in tablets, creams, shampoos, and gels. Although effective for fungal infections, especially in nails, its oral use carries serious risks. In 2013, the FDA warned about the dangers of oral ketoconazole after a patient's death. The drug can cause fulminant hepatitis and, when combined with other medications, lead to fatal problems. Since then, oral use has been restricted to specific cases. Moreover, treatments for fungal nail infections are lengthy, increasing the risk of severe side effects. Today, there are safer options on the market. Ketoconazole creams and shampoos are much safer, as they don't harm the liver or heart. In tablet form, ketoconazole can affect the heart's electrical conduction, causing dangerous arrhythmias. When combined with drugs like dofetilide, methadone, or dronedarone, the risk of fatal arrhythmias is even higher. Medication number 3, DPP, for inhibitors. These drugs are used to manage type 2 diabetes, helping to lower blood glucose easily. However, they increase the risk of heart failure in patients with pre-existing heart conditions or arrhythmias. The FDA issued warnings years ago about this danger. Research shows higher rates of hospitalization for heart problems among DPP-4 inhibitor users, even among those with no prior cardiac history before treatment. Today, the use of these drugs is approached with extreme caution, reserved for specific cases and with constant heart monitoring. Medication number 4, certain antihypertensives. A major European study analyzed thousands of people and found an increased risk of heart attack among users of certain blood pressure medications, especially nifedipine and amlodipine, both from the dihydropyridine group. In high doses, nifedipine showed a greater risk. These drugs work by blocking calcium channels, affecting heart cell function. Although some studies don't fully confirm this link, the warning is out. High doses of nifedipine can be dangerous. Medication number 5, fluconazole. Like ketoconazole, fluconazole is an antifungal used to treat candidiasis and other infections. The problem? It can cause severe liver failure and alter heart electrical conduction, raising the risk of fatal arrhythmias. Among these arrhythmias is torsades de pointes, which can be deadly if not treated promptly. Patients with a history of heart issues should use fluconazole with extreme caution and always monitor blood electrolytes. Medication number 6, hormonal therapies. Hormone-based drugs are used in treatments like estrogen replacement during menopause, helping with osteoporosis and symptoms like hot flashes. Oral contraceptives also fall into this group. Both hormone replacement therapy and contraceptives can increase the risk of blood clots, heart attacks, and strokes. The use of these medications requires careful medical evaluation, especially for women with cardiovascular risk factors. Medication number 7, stimulants. Drugs used for ADHD, narcolepsy, and social anxiety, like dextroamphetamine and lisdexamfetamine, improve concentration but raise blood pressure and heart rate, increasing the risk of heart failure. The use of these stimulants should only occur with a confirmed diagnosis, under strict medical supervision and constant heart monitoring. In 2011, the FDA emphasized the need for cardiac evaluations before and during the use of these drugs. Medication number 8, antidepressants. Used to treat depression, anxiety, and chronic pain, antidepressants affect neurotransmitters in the brain. But some, especially tricyclics like amitriptyline, carry serious cardiovascular risks. Today, we wish that your health is in the best possible condition. As the old proverb says, love one another and help one another. By subscribing to our channel and sharing our videos, you help us continue bringing more content that will help keep your health balanced. They can alter heart rate, cause arrhythmias, and even sudden death in extreme cases. Nonetheless, newer antidepressants are much safer for the heart. As we've seen, there are several medications that, if not used carefully, can severely harm your heart. Combining drugs without medical guidance increases this risk even further. So always get informed about side effects and interactions, and talk to your doctor about the best options for your health. If you made it this far, leave a comment. God is the way. Did you enjoy the video? Then like it, share it with family and friends, and help more people learn about the hidden risks of common medications.